In this video, we are going to look at how to code diagnoses from the genitourinary system, the pregnancy chapter, the conditions arising in the perinatal, as well as congenital malformations. As always, I will give you some scenarios. I'm asking you to pause the video after each scenario, try to find the correct code, and then unpause and compare your answers. So in the first scenario, we have a 66-year-old male who is seen today for chronic prostatitis. Go ahead, pause your video. When you think you have the code, unpause and compare the correct answer. So for this answer, you should have N41.1 chronic prostatitis. How we found that is by going to our index, going to PR for prostate, once we get to prostate, we're going to prostatitis, then down to chronic, we get N41.1. So our second scenario, we have a 28-year-old who is currently 29 weeks pregnant with gestational hypertension. So for this case, you're going to have two codes, one for the gestational hypertension and one to show she's at 29 weeks gestation. So again, go ahead, look up the codes, unpause the video when you think you have them. Okay, so our first code for our patient with gestational diabetes is the gestational diabetes code, which is O1.3. We're picking third trimester because she's currently at 29 weeks. The second code we're assigning is Z3A.29 to show the weeks gestation. So Z3A, and then we're going to pick 0.29 for 29 weeks gestation of pregnancy. So how we look these up, our first one, we're going to go to pregnancy, complicated by hypertension, and it tells us hypertension and renal disease, or right here, hypertension, C, hypertension complicating pregnancy. So now we're going to go to H, to hypertension, then complicating pregnancy, and ours was gestational, so it gives us O13 point, and it has the additional character we need with the dash and the check mark. So once you get to the tabular, you would select the 3 for the third trimester. And then for the weeks of gestation, you want to look that up. If you come to gestation, it tells you to see also pregnancy. So once we get to pregnancy, then you go to W, to weeks of gestation. And we're going to pick 29 weeks. So that's where we get the Z3A.29. Our next scenario, we have a newborn that was born via C-section. So go ahead, pause the video, see what code you come up with, and we will compare. So for a newborn born by C-section, our code would be Z38.01. Single live-born infant delivered by cesarean. So to find that in our alphabetical index, we would go to N to newborn. Born in hospital by cesarean, and that's where we get the Z38.01. And our final scenario, we have a 2-year-old Mel who is seen in the clinic today for Down syndrome. So go ahead and find the code, unpause the video when you think you have the code, and we will compare. So hopefully for that one, you came up with Q90.9. So if I go to Q90.9, Down syndrome, unspecified Down syndrome is also known as trisomy 21. So it's Q90.9. And to find that in the index, you can go to D to Downs. Or if we went to syndrome first, syndrome Downs, it tells us see also Down syndrome, but it gives us the code Q90.9. So then if we would go to D to Downs, Down syndrome Q90.9. That's how we find that code.